behind you will be full glass doors that slide open and close. And so you'll see there'll be a lot of light as you enter the first floor. Off to the left here will be a clinic space. So it'll be clinic and rehab, outpatient rehab space here. And to the right, we don't have it now because they haven't done all the interior studs obviously yet, but there'll be a greeter station and an entrance into our surgery department. You can see where all the plumbing is coming up from here to the windows back there. All of that will be our surgery department, where we'll have 3 ORs, an endo room where they do endoscopies and things, a sterile core around the OR space, and a waiting area here for the OR. So this is our future OR. We'll walk this way. As you can see, straight ahead, we have a line of windows, and that's going to be our commons area. So when you're standing in the lobby space, which this will be, and there'll be walls here and walls here going into departments, you'll see there's a lot of light. There's light coming from the main entrance and coming from the commons area, and that was important to us as we designed the building to make sure that when people walked in, they had a sense of nature and natural light, and for healing and for just soft lighting. So follow me this way. So this opening up here will be an open staircase that will go up to the second floor. There'll be glass and similar to what we have at St. Agnes Hospital. If you've ever been there, it's real open, so that there'll be light coming down from the second floor and light going up to the second floor from the first floor as well. All of this here, again, is still clinic space and the rehab department. Probably until about here. Then we go into the commons area. And this will be where there's dining. People can dine here. There'll be a couple of conference rooms off to the right.
I'm sorry, I didn't hear you say what you're here.
This will be a commons area, so the dining area, okay. But we'll use it for other things like community events, and people may use it for hours. If a community group wants to come in and use the space. And back in here will be all of our kitchen. So a lot of the plumbing you see here will be for kitchen space, and where we'll have a dining area that you walk through to get food. That will go back to the back wall here. And I think as you go over a little bit more is where we have some materials management and other space. X-ray. Yeah. Okay, so this will be looking at the main elevators going up to the second floor. So this is where visitors and others will come to get to the second floor, and the staircase will be right next to it, coming down out of that space there. This space here will be medical imaging and our lab. So off of a main entrance, they'll come down a hallway and be able to access our imaging department and lab department. Again, all of that space over there is the OR space. Medical imaging, and we're going towards the emergency room now. So from that line of columns, this way, will be our emergency room. Our ambulance garage, you can see back there. Is that correct? Yeah, we'll go back there. See the second entrance to the hospital. So the ER entrance and then the after hours entrance. So we'll be closing the front entrance like we do now around 7 or 8 o'clock at night, and then all visitors and others will come through our emergency room entrance, and we do that just from a security perspective. Where the windows are here, we'll have a meditation area as well. So some people like to call it a chapel, some people like to call it a meditation area, where we'll be building a space that people can go and just have some quiet time and have some reflective time while they're here. We're excited about this space. Our hospital, we had a chapel many years ago, and when we started our process of the build, many people asked me, are you going to have a space similar to that again? That was important for us. And so we're having fun right now designing this space and having it be a tranquil space for people to come. So whenever they have loved ones that are here or whatever. So then this will be our ER department. Exam rooms down the hallways here. ambulance garage back here. So there'll be a separate loop outside as well for the ambulance to come in. They won't be sharing driveways like we currently do, so they'll have a loop of their own. There'll be an entrance coming into the building, into the site from towards Douglas Street. We'll have an entrance just for emergency access, and then we'll have the main access that we all came in today through that main road. Also in our ER, we built in some hazmat, hazardous materials, things that we use, a tent and some other equipment that we use in case of any disasters that occur. So this is our emergency room. So this is kind of going behind the medical imaging area that I talked about before. You can see it from that way. But it's still easy. On this side of the columns is our medical imaging. Okay, you can step out here for a minute. Provide us the ability to do some mobile technology. So as we look at PET scanning or other things, we can pull up and do mobile technology here. We will have an MRI, a full MRI in our building. So currently we have a trailer that comes up. We may use it intermittently as we move. We may use mobile technology, but we will have that feature full-time in our building. And so this allows us, as healthcare changes and as technology changes and they come out with new stuff, we built in an area where they can pull up and we can try different equipment, or we can, rent different equipment as volumes fluctuate if we need to. And then just a shot of the back of the building as well. We'll go up the stairs and look at second floor unless you have any questions on first floor so far. Well, we're down here. No? Okay. I don't know if any of you have used our ER, but as you walk through that space, I know this is the first time I've been in this building, and so it was quite impressive to me to see how much larger that space is, and it just gives us so much more room to do our work as we look at even just our emergency room. So I think we added, Tom, help me, our current fair square footage of our ED is about 5,000, and I think this one is closer to almost 9, right? So.
Nice.
Yeah. You can see some of these other elevator shafts that come down. We were very intentional on how we planned our elevator shafts so that we were separating the patient experience from employee experience so that we're not mixing patients with other things. So these are our main elevators. That's what we call a back of the house elevator where food and supplies, things like that are able to go up. And then you'll see an elevator back here that goes directly to the surgery room. So that's where only our patients will go up and down for surgery, for C-sections, and other things. So we are patients from the ER will use that are being admitted from the emergency room. So we were very intentional about where we place those so that we could separate that experience and give our patients some privacy. So you're entering the rehab department right now. So half of this will be rehab, the other half will be some office space for the clinic where we'll have orthopedics and podiatry and some other services on the first floor. Can we get back there? I want to poke your head into our wellness center as well. So you'll see that in our current facility, we have some of our wellness activities occurring in our rehab gym. If you remember from the last time we met, I mentioned that we're going to have a totally separate wellness center. So that's what that is on the end. There will be a hallway, that's what those two double doors are, that will connect the wellness center to the hospital building outside of the rehab department. So if patients are coming to use the wellness center and they have an appointment or something in the hospital, they don't have to go through the rehab department or the clinic to get back into the hospital and vice versa. There'll be a separate space for them to do that. And you can see we put a lot of windows here on the south side as well. We were trying to really optimize any natural light that we could. And so we lined this wall here with windows as well. There will not be a wall that goes all the way up to the ceiling to the rehab department. There'll be some half walls and other things so that they can also borrow on that natural light. So this will be the rehab gym, just for rehab patients, and then we'll have a separate wellness center for our wellness community members. And we're using a two-tiered approach in our wellness center. So this part up here will be somewhat of a social gathering area. We have some drinks and some snacks and things available to our wellness center members. And then you can take the stairway down on either side, and that's where all of our exercise equipment will be. So treadmills and weights and all of that sort of thing. And these windows then, when you have windows in, you can see a nice view of our pond. Over to the right-hand side here where it kind of dips down, that will be a classroom area where we can do yoga and spinning, and we even we'll bring in people to do cooking classes and other things within our wellness center. So there's some office space back here, some consultation space so that if people want to meet with our wellness coordinators or our athletic trainers, we'll have a space for them to do that as well. Locker rooms are down this way. It's great stuff. Any questions before we go upstairs? Okay. All right. Yes.
You mentioned that this is because of the foundation.
We have in the past, but I'll mention that again, that if, just to remind you that this wellness center was made available to us through the generous donation of our foundation. And they donated $2.4 million for us to be able to do this project. So we would not have been able to do it without their support, and so we've been very grateful for their donation. So, okay, and there will be a separate entrance. I didn't talk about that either. There will be a separate entrance so that if it's a 24-hour entrance as well, so if people want to come and use the facility and don't need any other things going on in the hospital, they have a separate place where they can enter and exit as well. Okay. So this is the patient elevator again that comes up to the second floor. You remember what it looked like downstairs. And the open stairway you can see with the wooden gate around it. This is where patients and visitors will come up. So they'll come off the elevator, off the stairway, and all of this is clinic space. So this would be family medicine, internal medicine, OBGYN, general surgery, infusion clinic, medical oncology. So a lot of the clinic services will be right here. Back here will be conference area, my office, administrative offices, pharmacy, inpatient pharmacy. We'll have diabetes education and respiratory therapy in this area here. So a lot of clinic type space up here and administrative space. And as we walk this way, this will be all of our inpatient space. So it'll be our inpatient rooms, ICU, women's and infants, all on this end. So this is the entrance. There'll be another entrance here for some clinic space. We designed this for our infusion clinic here. A lot of times those patients come in and they're here for hours, and so we wanted to be able to give them a nice view. And,
Is that like dialysis and that?
no, that is like if patients come in and they need frequent antibiotic infusions, or they need what's called Remicade infusions. They're infusions for colitis or different digestive disorders, those sort of things. So they may have to come in for 7 days a week, or 3 times a week for 4 hours, and so we wanted a place for them to be able to borrow on the natural light and see outside and be comfortable. So we designed this space specifically for them. And then again, all of that is clinic space. Okay, and this is our inpatient area as you walk in here. So it'll be like a big square. All of our patient rooms will be around the perimeter. So they have windows in them and natural light as well. So as you walk on the unit, some of these areas will be some administrative offices for our hospitalists and our director, and some of those administrative offices for the inpatient areas. Otherwise, all of this is our inpatient area. In fact, I think those 2 windows there are our labor and delivery postpartum rooms. Am I thinking correctly? Yeah. I just had to see where I'm at here. So our labor and delivery postpartum rooms will be there. If you met with me last time, I did talk about shelling some rooms for growth, so we'll actually be building the exterior structure, but then shelling an interior structure for when we need to build those out, and that's that line across there. So that will be shelled space for future growth. Otherwise, all of this will be patient rooms, and I'll have you take a peek back here. How much we've expanded this space compared to what we have now. And a lot of that expansion is from going from semi-private rooms to private patient rooms. And so each of our patient rooms, Tom, help me, 250 square feet, right? So right now, a patient room is, what are our current patient rooms, about 200 that are semi-private?
Yeah, what's known as the rest.
Yes, yes. Right. So our current patient rooms, and they're semi-private, so they share them, are about 200 square feet. We're moving to a private patient room, which is 250 square feet. And a lot of that growth is to make them more handicap accessible. A lot of our patients who come in need wheelchairs, need walkers, those sort of things, and there's different codes that are required by the state. And so that growth is due to some of those things. And to add a little more space for when the family wants to stay. So half the room will really be divided, about, I should say, a third of the room will be for family space. Couch and computer area and some other things for family amenities as we look to encourage family members to stay in the healing process. So the patient rooms will be around the perimeter of this big, huge square that you see. We'll have the first couple rooms as ICU rooms, the rest will be med-surg rooms. I showed you where we'll have some shelved space, and then our OBGYN or women's and infants rooms will be at the front of the unit. So, and all of this internal stuff will be nurses' stations and supply areas, medication areas, clean and dirty utility, all of the things that go along with taking care of patients. So, but you know, this is my first time in here as well, and so, you know, as I look at it, I just, again, really, we are so blessed as a community to have this, and the space is just unbelievable. Our associates are going to be so excited to have this. You know, we struggle at times with where do we put this and how do we do that, and you know, it's going to be beautiful. We're going to have a lot of space to do what we need to take care of people, so exciting. Watch your step here. I'm just going to talk about the things I know up here, and then I'll turn the rest over to Tom. And about the only thing I know up here is the view to our pond. So you can see the view of the pond, which I think is spectacular. We'll be able to see that from downstairs. You know, be lucky to have views like that from our building. So Tom, I'll let you talk a little bit about, I know we've got a place for some of our generators and things that maybe you want to touch on.
Actually, all the built-up areas that you see here is where the HVAC equipment will be set in place. There's two different buildings here. You got a business occupancy, and then you have type 2 or healthcare inpatient occupancy. So there's different systems that will be in place on the roof. Actually, there's not much more to say at this time. It's a roof.
What it is. Okay, so you had your first tour of the new Ripon Medical Center. I want to thank you for taking time today to come out here. I'm sure it's as exciting for you all and for the community as it is for me and the employees of Ripon Medical Center and Agnesian HealthCare. I'll entertain any questions that maybe I didn't hit on the tour, anything else you'd like to see while you're here. You can see we have a lot of work to do yet, and we'll bring you back again, I'm sure, maybe even a couple times, but a lot of the work now is going to be interior. They tried to get a lot of the exterior stuff done before the snow flies, and so temporary windows go in when, Tom? Soon.
What you see here is the temporary windows. The actual glass is being installed currently.
Okay.
Yep.
So the actual glass is being installed. They'll be working on the interior studs, so that's when we can really start seeing where the lines of the departments develop and rooms come together. Putting on roof information. Yes, sir.
You may have already been in the flyer. When do you look at opening?
We look at opening next fall. So our tentative timeline is October, November for first patient. And so we'll be working on a lot of things until then, coordinating the move and
What are the major, I know you went over it again, I'm trying to get on it.
Sure.
What are the major facilities that you're going to open? You seem to have different sectors. What's going to be, are they opening in different sectors, and what are you giving Ripon that it hasn't happened?
well, we'll be opening the hospital. We're planning for the first patient to be able to have all of the services of the hospital at that point. And so there may be duplication, so we may need to staff it differently here so that both facilities are open for a period of time, because as you can imagine, we have to make sure that there aren't patients coming in there. We can't close our emergency room, for example, and so we have to make sure that there are people staffed there, people staffed here, and we're able to operate and have the support services that they need as we do that. And so there'll be I'm thinking a couple day overlap where we may have some different departments staffing both places, but we're working on all of that detail as we speak. We have very in-depth task forces working on just those things. So what are we bringing to Ripon? I think you saw it today. I think we are so fortunate as a community and as an organization to be able to do something like this in this time of healthcare and in this time of our country. And we are just truly blessed to have a beautiful new facility where people can come and heal and have the amenities to be able to be family friendly and patient friendly and be a partner in this community. I think this shows that we're here for the long haul and that we care about the people that use our place. And so we're giving people a place to come, a place to heal, and a place to be well. We have a brand new wellness center, and our focus as Agnesian HealthCare has really grown to focus more on wellness. And so it was important as we planned this new facility to make sure we did that through the commitment of a wellness center. And so we're here to support our community in whatever health need they might have, good or bad. So
From a recruitment standpoint, how many more additional employees will it require?
we are doing a replacement facility. So it's not, even though it looks larger, we do not have, we'll be replacing our current facility. And so we won't look at first to recruit any more employees because we'll be bringing the same employees over that we have currently.
Okay.
So the extra space that you see here is really to expand room, as I talked to about our inpatient area, to bring it up to handicap accessible and space for family, those sort of things, and bringing all of the services on one campus as well, or most of the services onto one campus. We will have our occupational health services over in our clinic right across the way here, but we'll be bringing all of the physicians over on site and bringing their staff with them. So. Other questions?
Jump in front of everybody, just trying to get the audio.
Any other questions?
Catherine, I know you probably covered this. What is overall square footage?
Overall square foot, about 120,000? Yeah, 120,000 square feet. Our current facility is about 85. And so we're going from 85,000 to 120,000 square feet. So. Okay.
Well, thank you very much.
You're welcome. Thank you all.